So I'm extremely pleased to welcome John Plastow, who can help set the context for this event, can talk about CARE's experience of setting up this project. And John currently is actually Acting Chief Executive Officer of CARE International UK, but is also, at the same time, not quite sure how he's managing these two hats at the moment, the Programme and Policy Director, and has been since basically more or less the start of this project. He was working beforehand as Africa Regional Manager and has experience working in Western Kenya, Iraq and Sri Lanka, but also started Oxfam Ireland's office in Tanzania. So knows the area and the regions very well, and I'm looking forward to hearing your comments, John, from CARE's perspective on this project. Thank you very much.
Thanks, Kat. And good morning, everybody in the room, as well as, I believe, considerable numbers of people who are listening online. So as CARE UK, we're delighted to be co-hosting this event with ODI, with whom Kat said we've been partners. Obviously, they've been leading the research element over the last 5 years. And yes, I've been involved since the inception of Emphasis, or to give it its full name, Enhancing Mobile Populations' Access to HIV/AIDS Services, Information and Support. I won't ask you to repeat that, but HIV/AIDS Services, Information and Support. And it's really off the back of Emphasis. They're also drawing off other strands of work that we've been engaged in, particularly in Latin America, and you're going to be hearing some of that in the course of the workshop, but also other work in Africa on migration that we've invited you to this event. We're really pleased that the funding from the Big Lottery Fund has enabled Emphasis to achieve so much. In concrete terms, it's been 350,000 people at source, in transit or at eventual destinations that we've been able to help. This isn't a small number of people in terms of direct beneficiaries, and we've been able to help them with, in terms of demonstrably raising awareness around HIV/AIDS, but also, importantly, to enable many people to access health services across borders without fear. I think, as Kat was saying, we see Emphasis as a real model for provision of these kind of services, and it's that kind of outcome that's as important to us as the actual direct impact it's had in terms of what it offers in as a model for provision of services across borders and bridging services between the three countries, that's Nepal, Bangladesh and India. So while Emphasis has achieved a lot in terms of its direct aim of enhancing migrants' access to HIV/AIDS services and support, it really has been a platform for so much more, and it's really a touch point for a lot of other issues that we're going to be discussing in the course of the coming 2 days. We've worked with a group of people to tackle HIV/AIDS and migration, but we've learnt that working with these people, and particularly women, that they're really subject to a whole host of vulnerabilities. And the programme's been a springboard into engaging with and addressing a number of these issues, such as safety and dignity, workers' rights, gender-based violence, access to financial services and remittances, and access to health and other social services. And we're really proud that Emphasis has been flexible enough to really work on innovations in a number of these areas. I'd just like to highlight two. We've had some important successes with stakeholders in terms of linkages with banks and remittance companies to enable migrants and their families to have better access to financial services. We've also been able to strengthen governmental and NGO health services for migrants, including the important breakthrough of cross-border referrals for people living with HIV/AIDS. Just before we move into the breadth of the conference, I'd really like to acknowledge the generous support that Big Lottery Fund has provided over 5 years. This is a strategic grant, something rare in our business these days. And I was talking to Albert Tucker here, who's from the International Committee of BLF, and we're both of the view that it's really critical that this kind of long-term, strategic funding is there, so the kind of innovations that we've been able to achieve can come out, and we hope we can work with you. But thank you very much for all the support that you've provided. We hope that we can work to ensure that the Big Lottery Fund kind of is able to provide that kind of support. I know in the room there's a diversity of colleagues from the practitioner, research, governmental and NGO communities, as well as from the donor community. As we've seen, there are a number of people here from South Asia, and a number of people who've been critical stakeholders in this program, which in many ways I see as a very long piece of action research. But there's a couple of people I'd really like to acknowledge. Here we have Mohammed Nazaruddin Mia, who is the Health Secretary for the Government of Bangladesh, a very critical partner, and you're very welcome, sir, to our discussions. We also have, I believe, in the room, Narayan Prasad Kafle, who's the Joint Secretary at the Ministry of Women, Children and Social Welfare for the Government of Nepal. Thank you, sir. And finally, Dr. Rajan, who's the Chair Professor at the Ministry of Overseas Indian Affairs, the Research Unit on Internal Migration at the Centre for Development Studies in Kerala. Fantastic presence from very senior people from across the 3 countries, and that's hugely appreciated, and we look forward to hearing all of your views. It's really our hope as Care International that the work from Emphasis and other examples of work that we're doing on migration have long-lasting benefit for, of course, direct beneficiaries, but also through events such as these and other things that have taken place, as we've heard, by Emphasis, but also other initiatives, that we are able to support a whole host of other vulnerable migrants, and particularly women. In this regard, I'd like to highlight work that we've been doing in the Andean region, promoting the rights of domestic workers in association with national civil society and governments, some of which, such as Bolivia, have actually signed up to the UN Convention on Domestic Workers' Rights, something we're seeking to roll out further. The issue of gender and women's rights is really key to the core to the work of Care International as a whole, as I know it is to many of you. In this regard, we're particularly privileged to have Jill Helker here, the Director of International Cooperation at the International Organization of Migration. Jill's a key stakeholder in the core focus of our gathering on the issues of women, migration and development. Very welcome. But in order to advance efforts to put migration on the agenda as a critical issue in development, it requires the engagement of a diversity of stakeholders. And I know in this room, as we said, there are people from government, the private sector, academia and civil society. And I think at this time, when there are big issues at stake, we all need to be working together to influence in whatever way we can. And just to wrap up, as Care, I think we've got 3 issues that we'd like to highlight for advocacy coming out of our work on migration, and we hope these will be things that appear in the course of the 3 days. The first is to promote this issue of regional approaches to migration that seek to ensure that people at source and destination countries reap the benefits of interventions. And this has been one of the innovations of the Emphasis model. Secondly, we're keen to see the ratification of international regional standards to protect migrants. And as I've mentioned, particular relevance to us in a sector dominated by women migrants is the ILO Convention 189 on the rights of domestic workers. And finally, the big agenda to ensure that migration becomes a core focus for the international development agenda. And as we've heard, we're looking to the post-2015 agenda, the development framework, to see if we can still influence putting in place measures to ensure that social and economic conditions of migrant workers feature in that future platform. So I really look forward to engaging in the discussion over the next 2 days on some of the biggest global challenges of our time. Welcome to you all, and I wish you all a constructive and productive 2 days.
Brilliant. Thank you very much.